Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. We're going to go more into our series about avoiding lawsuits and regulatory complaints, standards of care, all that kind of stuff. Again, not an attorney. Definitely not, just an orthodontist. And my state of licensure and what I do and my standard of care might be different than yours. So it's up to you to learn your own stuff. Don't just go by what I'm saying. It should just be part of the conversation. So please watch all the previous videos first. No, they're not necessarily in a particular order, but I'm just making them as I think of them because I've had a bunch of people request it. So not going to reinvent the wheel. You can watch the other videos first. This will build on the other videos. So we're going to specifically go into ortho perio today. Perio, which is like top reasons for complaints and lawsuits. Like if there was a top, besides all the miscellaneous crap, if you had to pick one category, this is it, perio. So this is just, y'all, my content is meant for primary care dentists. Primary care means perio. P means P. You should know this stuff. There is zero excuse for you guys to have a lawsuit on a perio patient. There's no excuse. Again, how many times do I have to tell you this is not going to happen if you're doing phase 1 interceptive, which is, another top 3 reasons why I love phase 1 interceptive. We don't have perio problems. Well, I mean, occasionally it happens, but you better catch that if it does. And then you're not treating that case. I see 1 out of every 1,000 maybe. I mean, like, it's so rare. It's a unicorn. So assuming you're seeing adults, I mean, the no-brainer to this is use technology or don't take those type of patients. And for those of you who do not have Invisalign, do not have iTeros, you're going to have to do old school analog ways. Just be prepared, and it's going to be clunky, it's going to be a pain in the butt, it's going to take you a lot of time, and the patients aren't going to like it. It is much easier when you have a CBCT and when you have Invisalign. I'm just saying for ortho. So far, I felt that Invisalign's CBCT feature is extraordinarily accurate. It has never given me the heebie-jeebies when I see a case. It makes sense to me. If anything, it's a little on the conservative side. I think we can push it a little bit more, but I'm glad they keep it conservative. So, okay, number 1 reason is failure to diagnose or manage periodontal issues, past, present, future, okay? That means there was perio issues, there is perio issues, or there will be perio issues that happen as a result potentially to what you did. So if you do one of those things improperly, you might get sued or get a dental board regulatory complaint. If you understand the difference between a lawsuit and a regulatory complaint, please listen to my previous video. Okay, so if you are the primary care dentist, this is where it gets messier. Let's talk about what happens in an ortho office. Ortho office, usually patient is referred, right? If they're not referred, they found you via social media, then what do? We go find out who their primary care dentist is. We get a copy of a release, be it a cavity clearance and or a perio clearance, depending on if they're adult or a kid. If they're adult, they're getting a perio clearance. And a cavity clearance. If they're a kid, they're probably just getting a cavity clearance and something about hygiene. I have these clearances, my version of them, in my document store. If you want a copy, they're free if you're a client of mine. They're free if you did an a la carte session with mine. They're free. Well, a few of them are. You don't get all of them. But you can go to my document store, which is at my website, Straightsmile Solutions. Click on documents. If you've ever done an a la carte session with me, you get a few. If you've ever taken a class with me, you get a few. There's so many ways to get free documents from me, it's not even funny. Otherwise, you can buy them if you have no pre-existing relationship with me, and I'd be glad to sell them to you. Okay, or write your own. Nowadays with ChatGPT, write your own, but I recommend that you run it by somebody. I mean, probably your liability insurance company has stockpiles of these. You should ask them. So make sure you have a perio clearance signed. If you are the patient's periodontist, e.g. if you're a general dentist who is doing perio treatment in your office, you're the patient's periodontist. If you're not managing it right and the patient has bone loss and has recession, if it's in a holding pattern and it's not getting worse, the question is, well, can we even still do ortho? What's going to happen if we do this movement or that movement, or if we move this tooth this way? What's going to happen if we do IPR versus lower incisor extraction? What's going to happen if we flare the teeth? What's going to happen if we expand? If you don't know all those answers just based on the technology you have and your Clincheck, well, you probably shouldn't be taking that case then. You better know all the answers. So that's why you have to phone a friend. And that's why sometimes you have to call on the specialist. And yes, patients get upset when you have to send them to a specialist, especially if they have a copay. But you know what? I'm telling you again, this is the number 1 reason for regulatory complaints and lawsuits. I see these all the time, even in my clients. I mean, usually it's new doctors that come to me and they're like, I got this case. I'm like, what did you do? And then we clean that up real fast. They're not going to do that again. But yeah, these things happen. So, and then friendly reminder, that perio referral, that perio clearance has to be signed by the periodontist. The periodontist needs to say, yes, you're good to do treatment. You can show your periodontist the mechanics and the TMT. They might understand it. They might say, yeah, it's okay to flare, procline. Or they might just say, patient has history of perio. It's okay to start orthodontic treatment. They might say, can't start orthodontic treatment, needs treatment with me first. Okay, well then you can't start it. You don't get to start it then. If periodontist says no, it's a no. And it always blows my mind when doctors are like, well, I'm still going to do it. I'm like, well, you're still going to get a lawsuit, you know? So be it. Like, you're toast if patient ever complains. So, I mean, that's a thing. Remember, everything has to be signed. Everything has to be documented in the chart, not just a conversation. You have to actually show the proof that of how you're thinking in the chart. So it's pretty simple. Okay. What else? Let me see. What else? So periodontal clearance in writing, of course. And like I said, if you're the patient's periodontist, you're doing your charting, your probing, they should have healthy probing things. If not, they should be getting PMTs. They should be getting SRPs. They should be getting 1 month evals with new probing, and then they should be on PMT throughout ortho. This is how this works, which is every 3 months. If your patient, again, standard of care, PMTs every 3 to 4 months. Find out what the standard of care is. If your patient is refusing to pay for the PMTs during ortho treatment, don't take them as an ortho treatment case. Again, standard of care. You have to map out ahead of time what your expectations are for this patient if they're going to do ortho treatment with you, and put it all in writing along with the periodontal diagnosis and treatment plan. So if they need grafting before, if they need grafting after, you put it in the plan. If they don't go do what they're supposed to do, well, then that breaks your contract with the patient. Then you can dismiss the patient without any issues. And you don't always even have to give a refund if they didn't do things correctly. So again, it's all in how you map it out. Bone loss should never be recognized, always be recognized, but never be ignored. If there's any bone loss, it should be mentioned. But the patient should know if they have bone loss everywhere, or anywhere. And they should know what that specific ortho plan, what the risk is. And if you don't know what that risk is to that ortho plan, you need to phone a friend and get your periodontist, and not just give them a call. Like, they actually have to document something in writing. If you didn't, again, you have to take progress x-rays. What is the standard on progress x-rays? Well, progress x-rays in a healthy patient standard is every year. On a perio patient, it's going to be more often. It might be CBCTs. Again, you have to have them come in, get their regular PMTs, get their regular progress x-rays. And if things start to head south, they either got to go to the periodontist to get checked, and we have to do whatever treatment the periodontist recommends, or we have to discontinue treatment, or we just discontinue treatment. Again, you don't necessarily have to give a refund. You don't necessarily have to do retainers. You have to map all the stuff out ahead of time. In any perio patient, you have to figure out all the potential ways things can head south and map them out ahead of time. Yes, this takes time. But remember, this is a 6,000 or 7,000 or more case. This is what you need to do. Don't just do a Clincheck and be done. Perio maintenance has to be going on during treatment, whether you're doing it or someone else. If someone else is doing it, it's your job to make sure they're doing it. If they're not doing it, again, warning, dismissal, the end. You're done. This is what we do in ortho all the time. They have to go. So, part of being an orthodontist, especially, if you're not the patient's own periodontist or not doing it in-house, is that you have to be the paperwork collector. You have to put notes. You have to be checking. Someone has to check this every 3 to 4 months. It's unlikely the doctor's going to remember to check it. So lots of pop-up notes, and this is where electronic charting is really helpful, to keep an eye on things. So what can you do to protect yourself? Well, every single patient should be getting this all the time anyways. The whole risk, benefits, and alternatives, RBA, ? Or PARR plus ? Depending on what you call it. I call it risk, benefits, alternatives, and questions. But I guess the way they're teaching it now is PAR ? Which is procedures. What procedures are you recommending? Alternatives. What other alternatives are out there? Risks. What are the pros, cons, risks of every option out there? And a chance to ask questions. You have to put down the patient had a chance to ask questions. You document every single one of these. Nowadays with this whole, it's up to you. I know that there's charting, there's HIPAA compliant charting softwares that are out there that can pick up your whole conversation, which is the easiest way by far. Then they can transcribe it into AI. You can, of course, verify that it was done right, and you can put it in the chart. You can't just use ChatGPT, Grok, or whatever for that, because this is patient data, and no. That's a big fat no. But in any case, it is not that hard to document. Yes, it takes a little bit of time. It helps if you have someone helping you. I mean, but I used to just handwrite this stuff up. It wasn't that hard. I mean, you just spit it out, right? And once you start to get a template, it makes it a little bit easier. You can just, okay, this is my standard perio. And there's also additional informed consents that exist for periodontal patients. This is something, again, your liability insurance can help. I have some stuff on draft. Again, this is part of my document store. It may not be exactly what you need. Contact your informed consent company or consult ChatGPT. A lot of stuff out there that you can rebrand yourself. So don't forget your thorough medical and dental history, chief complaint, all the x-rays, read the x-rays, diagnosis, treatment plan, informed consents, general and supplemental if needed for a perio patient, and your PAR question mark or RBA question mark. Let's see. Initial records, progress records. Every year you should have a full set of progress records. Again, standard of care. Normal informed consent for Invisalign, normal informal consent for braces, as well as supplemental perio informed consents. The informed consents have to be in the language of your patient. So, I mean, the primary language of your patient, or you have to get a translator and document all that. And I'm not going to get into that because, again, this is stuff you guys should know. Yeah, okay, I think that's pretty much it. All right, that's my perio stuff. Again, this is pretty unacceptable for you guys to have perio. Plus, it can bring you a lot of additional revenue. But yeah, I mean, perio patients might not start treatment. Oh well. If a perio patient is scared off by this stuff, well, then I don't want them as my ortho patient. End of story. And another reason, again, to do phase 1 interceptive because it just makes it a lot easier. All right, thanks.